If you have constant ringing in your ears, that whistling, hissing, or buzzing that won't stop, and you've already had an ENT evaluation without finding a clear structural cause, there's a factor that often goes unnoticed and may be directly contributing to your tinnitus: vitamin B12 deficiency. This is not a promise of a magic cure, and this video will be honest about that from beginning to end. But it is information based on real science about an essential nutrient whose deficiency is surprisingly common in people over 60 and which has a documented link to auditory nerve health and tinnitus perception. Let's start with the honesty this topic demands. Vitamin B12 does not cure all types of tinnitus. Tinnitus has many causes. B12 deficiency is one of those possible causes, and it's treatable. But it only makes a difference if you actually have the deficiency. So the central message isn't take B12 and the tinnitus disappears. It's check whether you have a B12 deficiency, because if you do, correcting it may help your tinnitus and your overall health. If you are not yet subscribed, click now on the subscribe button and turn on the bell. Tell me in the comments where you are watching from. Why vitamin B12 relates to tinnitus. The 3 scientific mechanisms. Mechanism number 1, the myelin of the auditory nerve. Vitamin B12 is absolutely essential for the production and maintenance of myelin, the fatty sheath that wraps nerve fibers and enables fast, precise transmission of electrical impulses. The auditory nerve, the 8th cranial nerve, also called the vestibulocochlear nerve, depends on intact myelination to transmit sound signals from the cochlea to the brain correctly. When there's prolonged B12 deficiency, myelin degenerates. This degeneration affects neural transmission, and in the auditory nerve can result in anomalous signals the brain interprets as tinnitus. It's the same mechanism by which severe B12 deficiency causes tingling and numbness in hands and feet. Mechanism number 2, homocysteine and cochlear microcirculation. Vitamin B12 works together with folic acid and B6 in the metabolism of an amino acid called homocysteine. When there's B12 deficiency, homocysteine levels rise. Elevated homocysteine is toxic to the endothelium, the inner lining of blood vessels, and is associated with vascular damage. The cochlea depends on an extremely delicate terminal blood supply, with no collateral circulation, making it particularly vulnerable to any microcirculation impairment. Elevated homocysteine from B12 deficiency can therefore impair cochlear perfusion and contribute to both hearing loss and tinnitus. Mechanism number 3, neuronal function and neurotransmission. Vitamin B12 is a cofactor in enzymatic reactions essential for neuron function and neurotransmitter synthesis. The central auditory system depends on balanced neurotransmission. B12 deficiency can affect that balance, contributing to the neural hyperactivity underlying many types of tinnitus. The scientific evidence. A frequently cited study, published by Shemesh and colleagues in the American Journal of Otolaryngology, evaluated the prevalence of B12 deficiency in patients with chronic tinnitus, especially those with noise exposure. The study found B12 deficiency was more prevalent in that group than expected, and that supplementation brought improvement in the subgroup of patients who were actually deficient. This is crucial. The benefit was seen in those who had the deficiency. It was not universal. Tell me in the comments where you are watching. Turn on the bell. Why B12 deficiency is so common in people over 60. Vitamin B12 is absorbed in the intestine through a complex process that depends on stomach acid and a protein called intrinsic factor. Several factors common at this age impair that absorption. First, atrophic gastritis with reduced stomach acid production. Second, medications. Metformin, used for type 2 diabetes, reduces B12 absorption over time. And proton pump inhibitors, omeprazole, pantoprazole, esomeprazole, reduce the stomach acid needed to release B12 from food. Third, diet with reduced consumption of meat, eggs, and dairy. Fourth, bariatric or gastric surgery. This is why B12 deficiency is so common and underdiagnosed. How to know if you have a deficiency? The only way to know for sure is through a blood test. The basic test is serum vitamin B12. But there's an important nuance. The isolated test doesn't always detect mild to moderate deficiencies. So in suspected cases, doctors may request homocysteine and methylmalonic acid, which rise in functional deficiency even when serum B12 appears normal. The classic symptoms, besides possible tinnitus, include fatigue, tingling in hands and feet, balance difficulty, memory problems, inflamed tongue, paleness, and in severe cases, anemia. What to do if deficiency is confirmed? Treatment is simple, cheap, and safe, but should be guided by a doctor. Options include oral supplementation in adequate doses, sublingual B12, and in severe cases, intramuscular injections. B12 has no known toxicity at therapeutic doses, but it will only help tinnitus if the deficiency is the contributing cause. Medicare covers B12 testing and treatment. God bless you and give you much health. Until next time. Dietary sources of vitamin B12. Vitamin B12 is found almost exclusively in animal source foods. The richest sources are liver and organ meats, red meat, fish, especially sardines, salmon, and tuna, shellfish like clams and oysters, eggs, milk, and dairy. For those who eat these foods regularly and absorb well, dietary intake is usually sufficient. The problem arises when consumption decreases or absorption is impaired. Plant foods don't contain B12 in bioavailable form. Algae and fermented foods claiming to contain B12 provide analogues that don't function as true B12 in the human body. So vegetarians and vegans need B12 supplementation without exception. For omnivores over 60, even eating animal foods, age or medication-related malabsorption may make supplementation necessary, reinforcing the importance of testing. The difference between treating the cause and masking the symptom. Vitamin B12 isn't a tinnitus remedy in the sense of masking the symptom. It acts on the cause when the cause is deficiency. This differs from taking a sedative that reduces tinnitus perception without treating what generates it. When B12 deficiency is the contributing cause, correcting it treats the root of the problem: auditory nerve demyelination, cochlear microcirculation damage, neuronal dysfunction. That's why it's so worth investigating, because in the subgroup with the deficiency, correction can not only help the tinnitus, but also improves neurological, cognitive, cardiovascular, and hematological health overall. The warning signs of B12 deficiency beyond tinnitus. B12 deficiency is a systemic condition. Neurological symptoms include tingling and numbness in hands and feet, typically symmetric and starting in the feet, balance difficulty, leg weakness. Cognitive symptoms include memory problems, concentration difficulty, slowed thinking, and in severe cases, mental confusion that can be mistaken for dementia but is reversible if corrected in time. Hematological symptoms include fatigue, weakness, shortness of breath, paleness, signs of megaloblastic anemia. Other symptoms: smooth, red, sore tongue, mouth corner sores, irritability, and depression. When tinnitus appears alongside several of these symptoms, the probability that B12 deficiency is contributing increases significantly. Why B12 deficiency is dangerous when untreated. Untreated B12 deficiency over long periods can cause permanent neurological damage. Myelin sheath degeneration, if prolonged, can become irreversible. So it's not a condition to leave for later. The sooner it's identified and corrected, the better the prognosis, both for tinnitus and for overall neurological health. There are documented cases of people with severe neurological symptoms from B12 deficiency who were initially misdiagnosed and who recovered after correction. This reinforces the message: it's worth investigating because B12 deficiency is one of the few causes of neurological symptoms that is completely treatable and reversible when identified in time. God bless you and give you much health. Until next time. Other nutrients also related to tinnitus. Although B12 is the focus of this video because its deficiency is so common and so linked to auditory nerve health, Other nutrients also have evidence of relation to hearing health. Zinc has high concentration in the cochlea, and some studies show benefit from supplementation in older patients with zinc deficiency and tinnitus. Magnesium protects against noise-induced cochlear damage. Vitamin D, whose receptors are present in the cochlea, has been associated in recent studies with tinnitus, and its deficiency is also very common in older adults. Folic acid, which works with B12 in homocysteine metabolism, has some documented benefit in age-related tinnitus. The common point is that benefit occurs mainly in those who have deficiency, so a complete nutritional evaluation is the most rational approach. The importance of not self-medicating. Although B12 is safe even at high doses, the message isn't start taking B12 on your own. The message is investigate with a doctor. First, taking B12 without deficiency brings no benefit for tinnitus. Second, starting B12 before testing can mask the result, hindering diagnosis. Third, B12 deficiency can have causes that need investigation, like pernicious anemia, an autoimmune condition, or absorption problems indicating gastrointestinal diseases. Identifying the cause of the deficiency is as important as correcting it. A practical and honest action plan. First step, schedule a medical consultation and mention the tinnitus along with any other symptoms. Second step, request serum B12 and, if possible, homocysteine and methylmalonic acid. Mention if you use metformin, omeprazole, or follow a vegetarian or vegan diet. Third step, if deficiency is confirmed, follow guided treatment and investigate the cause. Fourth step, be patient. Correction and possible tinnitus improvement aren't immediate. Remyelination takes weeks to months. Fifth step, maintain other tinnitus management strategies, sleep hygiene, stress control, hearing protection, because tinnitus often has multiple causes. Final summary, vitamin B12 is essential for auditory nerve health, cochlear microcirculation, and neuronal function. Its deficiency is surprisingly common in people over 60 due to atrophic gastritis, metformin and proton pump inhibitor use, and reduced consumption of animal foods. B12 deficiency is documented as a contributing cause of tinnitus in a subgroup of patients, and its correction may help, but only when the deficiency actually exists. The message isn't, take B12 and cure tinnitus. It's, investigate whether you have B12 deficiency, because if you do, correcting it may help and is important for your overall health. The test is simple, treatment cheap and safe, and the benefits extend far beyond the ear. God bless you and give you much health. Until next time. Frequently asked questions about B12 and tinnitus. How long does B12 take to affect tinnitus? If deficiency is the contributing cause, improvement isn't immediate. Recovery of myelin sheaths and neural function takes weeks to months of consistent supplementation. Be patient and maintain medical follow-up. Does excess B12 cause harm? There's no known B12 toxicity at therapeutic doses. Excess is eliminated in urine. But that doesn't justify taking it unnecessarily, because without deficiency, there's no benefit. Can I identify deficiency by symptoms alone? Not with certainty. Symptoms overlap with many other conditions. Only the blood test confirms. If I use metformin, should I worry? It's worth testing B12 periodically if you've used metformin for years, because the medication reduces absorption over time. Is dietary B12 enough? For those with good absorption who eat animal foods, generally yes. The problem is malabsorption, common after 60. So the test is more reliable than estimating from diet. The connection between B12, tinnitus, and cognitive health. One aspect deserving special attention in people over 60, B12 deficiency affects not only the auditory nerve but also global cognitive function. B12 is essential for brain health, and prolonged deficiency is associated with cognitive decline, memory problems, and even conditions resembling dementia, but reversible when corrected in time. This means investigating B12 when you have tinnitus may reveal a deficiency affecting not just your ear, but your brain as a whole. Correcting that deficiency protects both hearing and cognition. It's one of those cases in medicine where a simple, cheap intervention, correcting a nutritional deficit, has benefits extending to multiple body systems. The American context. The United States has high rates of metformin use due to high diabetes prevalence and high proton pump inhibitor use for reflux, both major contributors to B12 deficiency. The aging American population is therefore particularly vulnerable to undiagnosed B12 deficiency. If you have diabetes, use metformin, take acid-reducing medications, and have tinnitus, B12 investigation is especially relevant. Medicare covers B12 testing and treatment. Don't let this possibility pass. B12 deficiency is one of the few causes of tinnitus and neurological symptoms that is completely treatable and reversible when identified in time. God bless you and give you much health. Until next time. The myelin mechanism and recovery in detail. Myelin is like the plastic insulation covering an electrical wire. Without it, the nerve's electrical signal transmits slowly, erratically, or incompletely. The auditory nerve is one of the most active nerves in the body, constantly transmitting sound information to the brain. When B12 deficiency damages its myelin, transmission becomes anomalous, and that anomaly can manifest as tinnitus. The important thing is that, in its early stages, this damage is reversible. The body can rebuild myelin when B12 becomes available again, in adequate quantity. That's why early correction is so important. The sooner B12 is restored, the greater the myelin's recovery capacity and the greater the probability of tinnitus improvement. In advanced stages, when damage has become irreversible, recovery is more limited, reinforcing once again the urgency of not postponing investigation. Tinnitus, in this context, can be an early signal that something is wrong with B12, a signal worth listening to and investigating. How the test is done and what values to look for. The serum B12 test is a simple blood test requiring no fasting at most labs. Reference values vary between labs, but frank deficiency is generally considered below a certain threshold, with a grey zone or borderline values at the lower limit. In that grey zone is where homocysteine and methylmalonic acid become useful. If elevated, they confirm functional B12 deficiency, even when serum B12 appears normal but low. So if you have suggestive symptoms and your B12 is at the lower limit, it's worth requesting these complementary tests. Don't settle for your B12 is normal if it's borderline and you have symptoms. Request the complementary evaluation. This is one situation where careful test interpretation makes all the difference between identifying and missing a treatable deficiency. God bless you and give you much health. Until next time. A note on medical honesty. The internet is full of information promising magic cures for tinnitus, miracle supplements, tricks that eliminate tinnitus in seconds, products promising what they cannot deliver. This video differs precisely in its honesty. Vitamin B12 is not a magic cure for tinnitus. It's an essential nutrient whose deficiency, when it exists, can contribute to tinnitus and whose correction may help. That's the scientific truth, without exaggeration and without false promise. If you have tinnitus, investigate B12, not because it's a guarantee of cure, but because it's a treatable cause worth ruling out. And because correcting a B12 deficiency benefits your health far beyond the ear. Honest medicine doesn't promise miracles. It offers evidence-based information so you can make informed decisions about your health. Final practical reminder for someone starting today. If you have constant tinnitus and want to investigate B12, don't start taking supplements first. Schedule a doctor visit, mention your tinnitus and any other symptoms. Request the B12 test, and homocysteine/methylmalonic acid if your B12 is borderline. If you take metformin or acid-reducing medications, mention that. If deficiency is found, follow guided treatment, investigate its cause, and be patient with recovery. Keep your other tinnitus management strategies in place. An essential nutrient, a common treatable deficiency, a simple investigation that can make a difference, not a magic cure. Science applied with honesty. Investigate your B12. God bless you and give you much health. Until next time. Why this matters beyond your ears. There's a broader reason to take B12 investigation seriously. B12 deficiency, left untreated, contributes to a cascade of health problems in older adults. Cognitive decline, increased cardiovascular risk through elevated homocysteine, anemia and its associated fatigue, peripheral neuropathy affecting balance and increasing fall risk, and mood changes including depression. When you investigate B12 because of tinnitus, you may be catching a deficiency that's quietly affecting all these systems. That's the hidden value of taking tinnitus seriously as a possible signal. It can lead you to identify and correct a deficiency that, untreated, would have continued to undermine your health in multiple ways. Your tinnitus might be the warning light that prompts you to check something genuinely important. Don't dismiss it. Don't catastrophize it either. Investigate it, systematically, with a competent doctor, and with the understanding that even if B12 turns out not to be your answer, ruling it out is a worthwhile step in understanding and managing your tinnitus. God bless you and give you much health. Until next time with more evidence-based health information. An essential nutrient, a common, treatable deficiency. A simple test that can change how you understand your tinnitus and protect your overall health. Investigate your B12. God bless you and give you much health. Until next time. Medicare covers B12 testing and treatment. Take care of your ears and your overall health. The B12 test is a simple first step toward better health. Don't postpone it. B12 deficiency is treatable and reversible when identified in time. Investigate, treat, take care of yourself. God bless you and give you much health. Until next time, good hearing health to all. Your tinnitus may be a signal worth listening to. Investigate your B12 today. Until next time, with more evidence-based health guidance. Take care. The auditory nerve myelin, the cochlear microcirculation, the neuronal function, all three depend on adequate B12. When deficiency exists, correcting it addresses the root. That is why investigating is worthwhile. God bless you and give you much health. 3 mechanisms. 1 simple blood test. A treatable cause worth ruling out. Investigate your B12. It matters far beyond your ears. Until next time. Take care of yourself and take your health seriously. God bless you. Investigate, treat, recover. Until next time with more health science. Be well. Until next.